We've all heard the stereotype, right? You get a gout attack, and everyone immediately assumes you've been feasting on lobster and washing it down with way too much beer. It's commonly called the disease of kings or a food-driven illness. While it's true that high-purine foods like rich meats and alcohol play a role, blaming your diet entirely is a massive oversimplification. And if your only strategy during a flare-up is to pop a painkiller and wait it out, you are setting yourself up for a much bigger problem down the road. Today, we are diving into the real root causes of gout, the hidden dangers of the painkiller trap, and the science-backed strategies you actually need to stop the flare-ups for good. Section 1, the 80-20th Rule of Uric Acid. Let's get one thing straight, the root cause of gout is hyperuricemia, which simply means having chronically high levels of uric acid in your blood. Uric acid is the final waste product of purine metabolism, but here is the kicker, where do those purines come from? Only about 20% of the uric acid in your body comes from external sources, meaning, the food you eat. A staggering 80% is endogenous. It's produced internally by the natural breakdown of your own body cells. So, while large epidemiological studies do show that heavy animal-based diets, like red meat and seafood, increase your risk, diet is just one piece of a much larger puzzle. Section 2, the silent drivers of gout. If food is only 20% of the problem, what about the rest? The truth is, whether your body produces too much uric acid or your kidneys just fail to flush it out efficiently, there are hidden drivers at play. Genetics, your baseline kidney function, and medications all play a massive role. And there's one major factor we can't ignore, body weight. In fact, a high body mass index, or BMI, is now recognized globally as the #1 risk factor for gout in young adults aged 15 to 39. Simply chalking your gout up to eating too much is not only inaccurate, but it distracts you from the core metabolic issues you actually need to manage. Section 3, the painkiller trap. Now, let's talk about the pain. When a gout attack hits, the joint becomes red, swollen, hot, and excruciatingly painful. Your first instinct? Grab a painkiller, fast. Non-steroidal anti-inflammatory drugs, NSAIDs, colchicine, or corticosteroids are indeed the frontline treatments recommended by medical guidelines to quickly relieve symptoms. But make no mistake, these drugs are a band-aid, not a cure. They only suppress the inflammation, they do absolutely nothing to lower your high uric acid levels. Relying strictly on painkillers means the joint pain might disappear, but your blood uric acid stays dangerously high. The urate crystals are still silently depositing in your joints, meaning your next agonizing attack is just a matter of time. Section 4, the dangers of quick fixes. Furthermore, relying heavily on acute medications isn't safe long-term. Take colchicine, for example. Its therapeutic dose is uncomfortably close to its toxic dose. For people with impaired liver or kidney function, this drug can accumulate and cause severe toxicity, including bone marrow suppression. Older adults need to be especially cautious. And while NSAIDs are common, taking them frequently can wreck your gastrointestinal tract and damage your kidneys over time. Section 5, the dual target strategy. So, what's the real solution? According to the latest 2025 anti-inflammatory treatment guidelines for gout, there is a major paradigm shift. Management has moved from just lowering uric acid to a dual target strategy. Target 1, rapidly control inflammation during an acute attack. Target 2, use long-term uric acid lowering therapy to stabilize your blood levels. The magic numbers? You want to be below 360 micromoles per liter if you don't have tophi, those hard lumps under the skin, and below 300 if you do. But here is a crucial warning, when you first start medications to lower uric acid, the sudden drop in blood levels can cause old crystals in your joints to dissolve and break loose. This can actually trigger a temporary, painful flare-up known as a crystal dissolution reaction. This is exactly why doctors usually wait until an acute attack has fully resolved before starting these meds. But once you start, don't stop. Quitting abruptly can cause a relapse rate of up to 81%. Section 6, the ultimate lifestyle playbook. Even with proper medication, your daily habits are the foundation of your defense. Based on the 2024 dietary guidelines, here is your playbook. First, hydrate aggressively to help your kidneys flush the acid out. Second, add low-fat or skim milk to your daily routine, as dairy proteins are proven to promote uric acid excretion. Third, limit high-purine animal offal, thick meat broths, and certain seafoods. Fourth, watch out for the invisible enemy, fructose. Sugary drinks, fresh fruit juices, and honey are massive drivers of uric acid production. And finally, cut the alcohol, especially beer and yellow wine, and focus on maintaining a healthy weight through regular exercise. Outro. To truly conquer gout, you need a three-pronged approach: identify and avoid your dietary triggers, use uric acid-lowering medications exactly as prescribed, and maintain a healthy metabolic weight. It's not just about what you ate last night, it's about how you manage your body's chemistry every single day. If you found this video helpful, make sure to hit that like button, subscribe for more health deep dives, and share this with anyone who still thinks gout is just a seafood problem. Stay healthy, and I'll see you in the next video.